Thanks very much. So I'm speaking to you from Turrbal and Jagera country in Meanjin, Brisbane. And also for full disclosure, I work as an abortion provider. So my passion is for reproductive health care and abortion rights and justice for patients and the women and pregnant people. But I'm really glad that the previous speaker spoke about the social determinants of health, because I agree that they're the things that we need to do to reduce the number of people who have to have urgent care. And not only with housing and nutrition, but also reduction in pollution, a focus on workplace health and safety. So I think there's certainly a lot that could be done to promote community health before we get to needing doctors and nurses to treat people who've got diseases. Just thinking of health more broadly in that WHO kind of framework of being not just the absence of disease, but our general well-being. So I certainly am in favour of expanding the number of things that Medicare covers and expanding the funding for Medicare, improving the indexation so that it does keep pace with the cost of providing care. The Socialist Alliance, our approach is to support and extend Medicare, but ultimately to move towards a model of care that's basically like a fully funded model, not fee for service, but salaried position, so that doctors and everyone working in healthcare get the salary that we need. That we have a network of community healthcare centres, ultimately that are the local place that people can go to for their healthcare. But in the meantime, as we have that's a whole other discussion. So in the meantime, as we have that discussion, protect Medicare, expand it, and make it so that it's a functioning system, because ultimately healthcare is a right and should be available to people, to the public, paid for by the public, and be free of cost at the point of care. That dovetails in with our approach to expand hospital funding, and certainly at least 50-50 from the federal, and really wherever you'd have a Socialist Alliance person in power. And clearly we know we're not about to get elected, but this is the vision that we're wanting to put forward, and we do want people to vote for us. It's our vision is one where whether it's state or federal, we adequately fund the hospital and healthcare system, and that goes to expanding funding for aged care and NDIS as well, fully funding it, making sure that workers in the NDIS in aged care facilities are properly paid, so those services can be fully staffed, and in order to take off that bed block issue that speakers have spoken about so eloquently tonight. And I think really with the combination of training enough doctors and all the other people that we need to make a health system work, and have people be fully paid while they're being trained, make it so that we've got dignity as healthcare workers, and on the other hand, making sure that things can be provided, high quality system can be provided so that the community has the healthcare it needs. And I'll just end on the other point that we're raising, and that is my passion, which is that we want to have adequate funding and the discussions with the states so that we can establish reproductive healthcare hubs, because we want for abortion and contraception care to be funded and paid for, because at the moment, women can get in general can go to hospital to have their baby if they need to, and may be able to access hospital care to have a miscarriage treatment if they need to. But abortion, which affects about 1 in every 5 pregnancies, is treated as this thing that's hived off to the side and stigmatised, and we want to have it treated as healthcare and be accessible for free in the public hospital system, with dedicated staff, so that no one's we don't want to be making people forced to provide care that they disagree with, but we want to recruit and train and retain staff to provide that with the dignity and respect that every patient deserves in every encounter.
Authorised by Alex Bainbridge for the Socialist Alliance, Brisbane.